Hello, good evening. My name is Dr. Chudi Ufondu, and today it's another episode of our open clinic with Dr. Chudi. Today's topic is very important. So today we're going to look at the common occurrence of painful sex. So is painful sex actually normal? It will surprise you the number of women who are currently experiencing painful sex. This is a topic that will help to broaden your understanding about your sexual health. Unfortunately, depending on the society where you live, sexual health and sexual health challenges are stigmatized, just like mental health. So people rarely talk about their sexual health challenges. Unfortunately, for this particular problem, it's common. About 75% of women will experience painful sex at some point in their reproductive life, even beyond reproductive life. So you can see it's pretty much common. So what we're going to do this evening is to look at the broad spectrum of the likelihood as regards painful sex. So we're going to make a couple of statements, which over time I will want you to evaluate in your own situation. So, but I will tell you this. It's important you prioritize your sexual health. Your sexual health mirrors your physical health. Your physical health mirrors your mental health. Three of them are equal and opposite. If your physical health is in a good place, if your emotional health is in a good place, if your mental health is in a good place, possibility that your sexual health will be good is high. Now, remember that majority of our community are looking for babies. So the earlier you deal with the things that might be stopping you from experiencing your natural ability to have a healthy sexual life, the better. Depending on the society where you live. Example, if you live in Nigeria, generally sex is seen as a taboo. There are so many spiritualization, there are so many cultural correctness. So you grow up with that fear. You grow up demonizing sex. You grow up believing that it's the man's word. So you're coming into that union, you're coming into that relationship with a negative mind, with a negative understanding. And also, if you're not careful, you're going to pass that same information to your girls. That's completely not right. You have every right to experience best sexual health, just like you have every right to experience best physical health and best mental health. So, for some women, it's possible it's something that just started recently. So, it's possible that previously you used to have a very pleasurable sexual experience, no pain, no dryness. Then, over time, it started. It can be psychological, it can be physical, it can be from an abusive situation, it can be due to health problems, gynecological problems, infections. So any of these things can lead to painful sex. Now, painful sex, it's called dyspareunia in medical practice. Now, painful sex can be superficial pain or it can be deep pain. If it's superficial pain, it means that at the point of contact between the penis and the vagina, you begin to experience this pain. Now, women that might have this type of pain might have a condition we call vaginismus. So, if you've had a terrible experience in the past, you were abused, you were raped, or you had a very bad impression about sex, the vaginal muscles that should ordinarily relax so that the penis can go in will contract. Now, if that happens, no matter how ready you are, no matter the level of lubricant you use, your vaginal muscles will not be relaxed and the penis cannot go in and it can be very, very painful. So, this is a commoner presentation depending on your orientation, depending on your culture, depending on if you're spiritualizing sex. Because guess what? Sex is meant for adults, it's not for kids. So, assuming you're in a loving relationship and it's painful and it's concerning, and you're dodging your partner whenever you guys want to consummate, remember that sexual intercourse it's meant for fun and procreation. So, if each time Your partner wants to make love to you, you give excuses because you're in pain and it's causing you concern and it's taking your confidence away. It's time to call your doctor. There is no reason for you to die in silence, because let me tell you what will happen. You might be the best wife, you might be the best girlfriend, you might be the best fiancé, you might be a very good lady, you might be beautiful. But if you are not fulfilling this aspect of your life, you might actually be depressed. You might actually lose your self-confidence. You might begin to think that something is wrong with you. Meanwhile, nothing is wrong with you. It's just something that happens. So at some point in a woman's life, she will experience this. The commonest cause of painful sex is dryness. Now, remember that as you're getting old, the level of couple of hormones will begin to change, especially estrogen. So it's expected that older women might likely experience painful sex. So if in the past, when you were in your 15, 20, 30, you didn't have painful sex, then suddenly you begin to experience this. Probably you're in your 40s, probably you're tending towards 50, or you're tending towards 60. It's expected that when you're getting to 40, 50, 60, the level of your estrogen is coming down because you're getting ready to get into menopause. So dryness can be a precursor to painful sex. Now, if that's your own situation, you can explore using lubricants. Now, because at that stage in life, you might not necessarily be worried about having a baby, you can go for any of the safe lubricants. But if at that age you are still planning to have a family, please consider fertility friendly lubricants. So think about Pre-Seed, Baby Dance, and Conceive Plus. But if you have completed your family, and of which, let me tell you the truth, it doesn't matter your age, you have to fulfill your sexual health. Couples that are in their 80s can still have the best sexual relationship. Sexual relationship doesn't necessarily mean that the penis will go in. So there are so many ways you can be in the presence of your partner and you guys can still find contentment, especially if you have kids. Kids have a way of changing everything, including your sexual health. Now, some women might stop engaging with their partner for one reason or the other. Maybe changes in the family dynamic, maybe they're quarreling, maybe she's stressing. When you don't engage in sexual practice for some time, when you engage in it later, it will be painful. So some women might inadvertently stop making love because of a couple of conditions I mentioned. It's expected that when you start, it will be a little bit painful. Now, for the partners, if you know the act of love making, if you know how to spice up your relationship, if you do the right things, if you involve yourself in foreplay, and you guys are in a very good place, then the possibility of mitigating dryness and painful sex will be limited. But the most important thing I want women to concentrate on is in the fact that you should not stigmatize your challenges. If you are not enjoying it, if it's painful, the moment it begins to be painful, ring your doctor. When you see your doctor, open up to your doctor. Your doctor is the best person that will help you to figure out the diagnosis. There are a couple of things that can lead to this. It can be PID, pelvic inflammatory disease. It can be fibroid. It can be endometriosis. It can be bladder issues. It can be dysvaginismus. It can be a couple of things. It can be fibroid. So a whole lot of this can affect your ability to come into your potentials, to make sure that you are having the best of your life. Because tell you what, so long as you're in this world, you're going to be challenged. So if you don't deal with this aspect of your relationship, the biggest problem in relationship is not love. The biggest problem in relationship is not finances, it's not money. It's actually lovemaking. So if you guys are not on the same page, maybe the man is getting it more or the woman is getting it less or whatever. If you guys don't understand each other, if the chemistry is not there, then you guys begin to go different routes. So you have to address this no matter your age. So long as you're in a relationship, talk about it. The more you talk about it, the more you can find the solutions. So I'm going to mention a couple of facts. Sex is not supposed to be hurtful. Once it begins to be hurtful, begin to seek for help. So, in as much as about 75% of women are going to experience painful sex at some stage, it doesn't mean it should be painful. So once it begins to be painful, you can have one or few occasional soreness here and there. Maybe you're not in the mood, maybe you're not in a good place, maybe you're not ready. That's okay. But if it begins to be frequently painful, ring your doctor, go in, let's know what's going on. Prioritize your sexual health. Prioritize your sexual health. The same way you prioritize your outlook, the same way you prioritize your physical health, the same way you begin to freak out when you have headache, when you have pain, that's the same way you should prioritize your sexual life. If you want it, if you are still young, if your libido is still good, but you are not getting it, and you know it's affecting your relationship, and you know your partner is constantly complaining, please prioritize it. Now, dryness, like I mentioned, is the commonest cause of painful sex. So once we identify the factor that is leading to painful sex, once we deal with it, like for the dryness, if we can deal with good foreplay, if the woman can be well hydrated, if the woman is exercising, if she's drinking a lot of water, if she's getting enough sleep, then if you guys engage in foreplay before you begin, then the likelihood that the woman will have a buying effect is very high. Unfortunately, the body of a woman and the man, it's not the same. Men can easily have satisfaction when it comes to sexual act, but women go through a lot of processes. A woman will go through spiritual processing, emotional processing before she can come to the physical processing. But a man can easily engage, and before you blink, it's all over. This is because of the anatomy of the penis. If you notice, the penis is hanging out, but the vagina, especially the real vagina, which is the hollow tube inside, you have to go through a lot of processes. So if the woman you're gonna make love to is not in the same place with you, it's gonna take her time. So they process a lot before they arrive at that junction. But it's your right to make sure you push for your sexual health. Nobody can push it for you. So there are a couple of other conditions apart from dryness, which can lead to painful sex. It can be endometriosis. So if the cells, which ordinarily should cover the womb, which is called the endometrium, it's seen elsewhere. So if we have endometrial cells in the ovaries, in the tubes, in the omentum, in the abdomen, they can lead to painful sex. Once we identify this, we can address it. Now, some people can have some bladder syndrome, which we call interstitial cystitis. So don't worry about it. It just simply means you have some bladder inflammation, which can mimic bladder infection. You have this intense urge to urinate. You feel a lot of pressure. You feel a lot of pain. Anytime you have such, making love will be painful. Some women can also have pelvic floor dysfunction. So if your pelvic floor muscles are not functioning the right way, then you might begin to have problems. Thankfully, if you have pelvic floor dysfunction, you can engage in Kegel exercise. Kegel exercise will help to strengthen your pelvic floor muscle so you can use your pelvic floor muscle properly. Some women can be having this pain together with escape of urine when you are laughing, when you are in a bad place, or when you're just by yourself, you don't want to do number two, suddenly you notice you're leaking urine and you're still a young lady. The older you get, the more the likelihood you're going to have this problem. But if you're younger and you discover that when you're laughing or crying or whatever, urine is coming out from your vagina, then you need to tighten your Kegel exercise. Very important. Now, some women might have pelvic floor injuries. So if in course of delivery, we damage a couple of muscles there or nerves, or we gave you episiotomy, or you had any procedure, over time, you're going to have slow recovery of your sexual functions. I've already mentioned the vaginismus. So if you have intense fear about sex, you were raped, you were abused, they told you a lot of horrible things about sex. No matter how ready, no matter how in love you are with your partner, the vaginal muscles will contract, the penis will not go in. It's extremely painful. Matter of fact, this is the scenario we normally see in those old fairy tale that, oh, the man went in and the penis couldn't come out. The vagina locked the penis in. That's actually what happens. It's called vaginismus medically. Okay. Now, some people can also have infection. It can also be ovarian cyst. It can also be fibroid. So these are the commonest things that can lead to painful sex. Now, what's the summary? Please don't suffer in silence. Painful sex has different causes. So once we identify the cause, then we are likely going to have proper treatment. So if you are currently avoiding sex because of pain, it's time to see your doctor. Your gynecologist is the best person to go to because your gynecologist will take time to ask you questions and figure out what the problem is. Once we have a diagnosis, we are in a better place. Most women are very reluctant to talk about their sexual life. Even some women that subscribe under me, when I talk about their sexual health, which is very important in infertility, they begin to be defensive, they begin to be shy and do all those stuff. Be open to talk about your sexual health issues, especially to your doctor. You might not be comfortable talking to your mom, your friends, your pastor, but open up to your doctor so your doctor can help you to understand what's going on. The more you open up, the more you tend to own your sexual life. Now, so many women blame themselves, so they are very easy to take up the blame. Oh, I'm the reason why this is happening. Oh, I'm the that. Stop blaming yourself. You are not the sacrificial lamb. Go and seek solution. That problem might be coming from your partner. That problem might be an infection. The earlier we identify it, the better. So please play a role in contributing to proper mitigation of pain during sex. So the more we increase the resources, the more we talk about this, the more we are able to encourage women to talk about this openly, the more it's going to be beneficial, the more we're going to enjoy our sex, and the more we're going to make babies. Remember, in our group, if you want to make babies, you have to make love 48 hourly. Okay, so that's my presentation this evening. I'm going to quickly open the floor to take your questions. So thank you, and go ahead and start asking your questions right now so I can provide you feedbacks. Okay, so don't be shy, be open. If you're currently having problems, I'm very much ready to help you navigate the problems. Okay, so let's see what we have. When should one see a doctor for painful sex, and what kind of doctor? You see, you know you're regular, right? So you know your normal self, right? Now, it's expected that the first sexual experience is going to be painful. Now, there are so many religious and cultural beliefs regarding the first sex. So, in some cultures, they will expect the woman to bleed and they will break the hymen and do all those stuff. That's not how it works. Some women would have inadvertently broken the hymen. The hymen is a membrane. Okay, so some women might be tomboy, they might be playful, they might be explorating or whatever, and they can break the hymen. So it's not true that the first sexual experience will lead to bleeding. So that first experience, when you're still learning, is expected it will be painful because you just started this. Both of you are novices and you're not used to it. But over time, by the time you learn the act of lovemaking, you know you're normal. So if previously you're not experiencing pain, then suddenly you're experiencing pain, painful bleeding, painful urination, pain everywhere. You're very uncomfortable. That's the time you need to ring your doctor. If your partner is coming to you towards south, you're going towards north, every single time you're looking for an excuse to escape lovemaking, that's the time to ring your doctor. So don't wait till it's very late to seek help, because you notice the list of the things I mentioned. So if suddenly you begin to notice this and you know it's not your normal, you have a high libido, you used to enjoy it, you're so well, you're so ready, then suddenly it's no longer what it used to be. That's the time you need to ring your doctor. So when you need to ring your doctor is based on your own individual experience. But the earlier you ring your doctor, the better. If you can fix this aspect of your relationship, believe me, you can have millions, you can have billions. Once your sexual health is going south, you are in trouble. That relationship is in trouble. Now, there are some times in the family when the family dynamics will change. There are some families that are not making love, not because they don't want to make love, but because the kids are there. Because the kids have taken over the whole spectrum of, you know, duty. Everything is all about the kids. They're invading your privacy. We can understand that. But if everything you guys used to enjoy is still there, but you notice you are constantly giving excuses, you are constantly avoiding this important aspect of your life, that's the time to seek for help. Now, coming to the right kind of doctor to seek help from, your gynecologist is the best doctor to talk to about painful sex. So it can be fibroid, it can be endometriosis, it can be ovarian cyst, it can be polyps, it can be UTI, it can be PID, it can be any of these Ds and OCs and all whatnot. But we don't have to guess. We need to know why. Now, we also need to teach your partner how to make love to you. We also need to teach you how to relax and enjoy your body. Every woman is given that ability to have the best sexual life, including having your orgasms. Okay, so this is where knowledge is very important. Okay, what kind of question should one expect to? What kind of questions should one expect from the doctor? Number one, anytime you have a problem in medical practice, we want to know the duration. So, how long have you been having this painful sex? What is the nature of the pain? Is it sharp pain? Is it superficial? Is it deep pain? So, in superficial pain, which might be due to vaginismus, the penis will not even go in. The woman is already shouting, she's already in pain. In deep pain, remember the medical condition of painful sex is called dyspareunia. If the pain starts when the man is already in and is thrusting, then that's deep pain. So it's likely not something at the periphery. So we need to know the duration. We need to know the nature. We need to know what makes it better. We need to know what makes it worse. We need to know other concomitant, symptoms. Are you feeling pepperish when you're going to use the restroom? Is there bleeding? Do you have, pain when you're defecating? So a couple of things we need to tie together to begin to make up our mind on what might likely lead to this. Are you involving in enough foreplay? What exactly is the nature of that pain? So your doctor will take time and ask you a lot of questions. What's your sexual experience? What's your current sexual experience? How long have you had this pain? Have you been having this? What have you done previously that made it better? So a couple of personal questions we need to ask you to develop our theory. So the questions I will ask you will be based on the first response you give me. So if it's an acute pain, that means it just started. Then I will begin to look at things that it's within your immediate environment. But if it's a pain that has dragged for long, or since you started making love, you've been having this pain, then it's likely it's the method. Because there are so many couples out there that don't know how to make love. So many. You might think you know, but you don't know. But if you understand it better, you can flip your body into the fun zone God created it to be. Okay? So please keep asking your questions so I can provide you feedbacks. This is a good opportunity. If today is the first time attending my clinic, I normally run my clinic in YouTube every Tuesdays, 7 p.m. Eastern Time, US, 1 a.m. in West Africa. It's just unfortunate. It's very early in the morning in Nigeria and a couple of other West African countries, but that's the only time I can come live. But on Saturdays, we start early. So Saturdays, 12 p.m. Eastern Time, 6 p.m. Western Time, Nigerian time. Now, if you're not able to attend the clinic in real time, when you wake up in the morning, review the video, make sure you subscribe, make sure you set your notification, ask your questions, share the video, practicalize. Learn how to take matters into your hands. Learn how to practice everything you're learning every day. Perfect practice makes perfect outcome. Okay? Can painful sex be psychological? 100%. Majority of women might be having painful sex simply because of the psychology of sexual intercourse. Whatever your mom told you growing up, most mothers would have told you that it's very evil. You don't engage in sex. If you do this, this is going to happen. You don't allow men to come closer to you. It's purely evil. And depending on what you had in the past. So if you were abused, if you were raped, you will have PTSD, post-traumatic stress syndrome. So once you remember that episode, it will tighten everything. You will be in a state of fear. So psychology plays a lot of role in so many women. Poor understanding, poor chemistry, poor fluid relationship between you and your partner. Look, it takes a woman a lot to open her body for another person to see her body, then begin to engage in sexual relationship. So if you don't have compatibility, if you don't have chemistry with your partner, it's gonna be difficult. So the psychology of painful sex, it's actually more important than any organic problems out there. So majority of women might be having problems with pain because of psychology, because of not letting go, because of not yielding. You have so many things going up in your mind. Maybe you're pissed with your partner. Maybe you're not in a good place. Maybe you're not enjoying it. Maybe you're not communicating. Unfortunately, so many women are not communicating their needs. So many women are just going to lie down there and they might say the opposite of what they are feeling. So many women might be in pain, but they will be telling the partner, I'm enjoying it. So many women might be enjoying it, and they'll be telling the partner, you're killing me. All those stuff, because you've heard it, because you've watched movies, because your friends have told you, and you begin to project those things in your own process. Every individual has their individual sexual makeup. So when you begin to see different people in your own sexual relationships, you begin to have problems. So psychology, it's very, very important. Compatibility is very important. Now, in our society, so many women want to marry rich, rich husbands, and so many husbands wants to marry beautiful women with shape and all that. Guess what? It's still the same one vagina, okay? It's still the same orgasm you're gonna have. It's still the same thing. It's how you value what you have that matters. So many women don't know what God gave them. So when you begin to belittle yourself, when you lose your confidence, when you're coming into that arena and you're feeling, oh, you're not satisfying your partner, you're looking at his countenance, it's always about him, you're not thinking about yourself, then you're not gonna learn. So sexual compatibility should be checked in relationship. Believe me, both of you might be born again Christian. Both of you might be spiritually going to heaven. But if you don't know, you don't know. I remember my experience in medical school. These beautiful couples came in. They were having problems. Normally when you come to the clinic, we'll ask you, oh, what's your presenting complaint? What was their presenting complaint? They wanted to know the difference between the anus and the vagina. They were going through the anus when they were making love instead of the vagina. So many women don't know the anatomy of the vagina. So many women don't know that we have two openings in the vagina. So when you know better, when you acquire more knowledge, when you understand that your partner understands sex, and you understand sex, and you understand your role, and you understand that you also can demand it, then you begin to make sense out of it. But if you married your partner simply because he's handsome, he has money, he's got a good job, or if you married her because she's beautiful and that, when the chips are down, guess what? When you go further into your relationship, when you go further into your marriage, there comes a point in time when all women will be the same. And that's the sweet aspect of your relationship. There will be a time you will see your woman, you will think, oh, what's going on? There will be a time you will see your man and you begin to wonder what's going on. So if you guys don't have the glue that will bind both of you together, you begin to crumble. That's the point some men will start looking out and some women will start feeling abandoned. And guess what? In our society today, there is no longer status quo. Women are finding their level, men are finding their level. Sexual compatibility is very important in your relationship. When you are dating, if your partner is not satisfying you, it's not going to change when you marry him or her. This is a fact. You have to talk about it. This is not, oh, you're doing this. There is no sin there. It's not abominable. This is your partner. You have every right to experiment, know what's going on, learn. Feel free. Like in our group, we have a couple of teaching aids. We have PDFs. We teach you all this because guess what? Your mom is not going to teach you. Your friends are going to tell you the wrong things. Things you watch in the movies might not be the reality. So, and some partners are not communicating. Some people make love only in the dark. Some people cannot identify their partner's, private parts. And it doesn't make sense. So the earlier you begin to talk about this, the better. Okay? All right, please keep asking questions. I love all these very direct, important questions. Please keep asking your questions. We have 2 more minutes to go. If you still have questions, please feel free to ask, and I'll provide you feedbacks. Now, remember, tomorrow is a brand new month. Guess what? It's going to be a December to remember. The 31 days in December in our organization is going to be amazing. We are cooking up a storm. The program we have for December is going to be double impact. So we're going to energize ourselves. We're going to take charge of the coming 2022. So be on the lookout. We're going to make a very big announcement soon, but make provisions for getting ready for 2022. And by standard, don't touch the dial on the 31st of December, because we're going to have a crossover Thanksgiving dancing clinic. We're going to launch into 2022, believing God to do amazing things in our life. So thank you. Tomorrow will be my Wednesday community health clinic in our group in Facebook and other social media. Make sure you join the clinic. Then I'll come back on Friday. Then I'll come back on Saturday. So my next YouTube clinic will be on Saturday by 12 p.m. Eastern Time. Hold on, guys. 12 p.m. Eastern Time, 6 p.m. Nigerian time. Then on Sunday, I come back from my maternal and child health clinic. If you have not been following, you wouldn't know what you're missing. So I promise you, you can only get the best in this group. So thank you for coming this evening. I appreciate you. In the absence of any other question, I'm going to take my leave. So join me tomorrow and you're going to have fun. Okay? So thank you for coming. Remember, when everything else fails, always pray. Play 48 hourly. Practice. Everything that has a beginning has an end. Everything that begins ends. Good, bad, ugly. So everything you're looking for, you're going to find in December. Now, if you didn't succeed up to November, guess what? You can succeed in December. This is a promise I'm making to you. If you can diligently tell yourself the truth, get all the help you need. Some people need to subscribe. Some people need to come out from their shell. Some people need to go for IVF. Some people need to go for IUI. Whatever you need to do to wrestle back your happiness in 2021, I'm challenging you to do that. Okay, so I'll see you guys on Saturday, but I'll see you tomorrow in my health group tomorrow for my community health clinic. Thank you for coming. My COO, I appreciate you, and I'll see you guys, and bye-bye for now. God bless.